Hi, welcome to BabyBites. Before your baby can say real words, they may already be trying to tell you something. The tricky part is that parents often have to guess. Are they hungry? Do they want more? Are they tired? Are they uncomfortable? Or do they just want you close? That guessing can feel exhausting, especially when your baby is crying and you really want to help. This is where baby sign language can be useful, not as a strict lesson, not as pressure, and not as a magic trick, just as a simple way to give your baby one more tool to communicate before speech is ready. Today, we are talking about how baby sign language can help you understand your baby's everyday needs more clearly, and how to start in a gentle, realistic way. Baby sign language means using simple hand gestures together with spoken words. For example, when you offer milk, you say milk and use the sign at the same time. When your baby wants more food, you say more and use the sign. Over time, your baby may begin to connect the gesture, the word, and the real life need. It does not need to be perfect. Your baby does not need to copy the sign exactly. Even a small, repeated movement can become meaningful if you understand what your baby is trying to say. Many babies understand more than they can say. They may recognize routines, familiar words, faces, foods, and daily objects before they have the mouth control and language skills to speak clearly. That gap can be frustrating for both sides. Your baby may know what they want, but they cannot say it yet. You may want to respond, but you are not sure what they are asking for. Simple signs can become a bridge during this stage. Instead of only crying, reaching, or turning away, your baby may slowly learn that a small gesture can help you understand. And when parents understand a need sooner, the whole moment can feel calmer. Many parents start noticing more intentional gestures around the second half of the first year, often around 8 months and onward. At this stage, some babies may wave, reach, clap, point, or copy simple actions. These natural gestures show that babies are beginning to use their bodies to communicate. But this is not a deadline. Every baby develops at their own pace. If your baby is younger, you can still use spoken words and gestures naturally during routines. If your baby is older, it is not too late to try a few simple signs. You do not need to start with many signs. In fact, it is usually better to begin with a few words your baby hears many times a day. The first one is milk. Each time you offer milk, say the word clearly and use the same sign. You can say, "Do you want milk?" Then wait for a moment so your baby has time to watch you. The second one is eat. During meals or snacks, use the sign while saying eat. Babies learn best when the sign is connected to something real that is happening right now. The third one is more. More is very useful because babies often want another bite, another song, another game, or another turn. When your baby seems interested in continuing, you can say more and use the sign. The fourth one is hurt or uncomfortable. This one should be used softly. You might use it when your baby bumps themselves, has discomfort, or seems upset. Pair the sign with a caring facial expression and calm voice. Here is the simplest way to start. First, say the word. Second, make the sign. Third, repeat it during the same daily routine. For example, every time you offer milk, use the same word and the same sign. Every time you ask if your baby wants more, use the same word and the same sign. Keep your face warm and your voice natural. Babies pay attention to your expression, your rhythm, and the moment you are sharing. If your baby just watches, that is fine. If your baby makes a different version of the sign, that can still count. If your baby loses interest, you can simply try again another time. Baby sign language should feel like connection, not homework. It is important to keep expectations realistic. Baby signs do not guarantee that your baby will cry less. They do not guarantee faster speech, and they are not something every family must do. They are simply one gentle tool that may help some babies express common needs before they can talk. The most helpful signs are the ones you can use consistently in real life. A few simple signs used often are much better than many signs used once in a while. And if you ever feel worried about your baby's hearing, speech, eye contact, gestures, or overall development, it is a good idea to speak with a doctor, speech language therapist, or another qualified professional. You do not need to figure that out alone. At the heart of baby sign language is something very simple. Your baby wants to be understood, and you want to understand them. Even one useful sign can make a normal day feel a little smoother. Signs like milk, eat, more, and hurt can become little bridges between your baby's needs and your response. So if your baby cannot talk yet, you do not have to guess everything forever. You can gently give them another way to show you what they want. And remember, the goal is not perfect signing. The goal is connection. See you next time on Baby Bites. If you want more parenting tips, remember to subscribe to Baby Bites.